Okay, I'm Sydney Stoltz, and I'm going to be demonstrating a subcutaneous insulin injection today. So, alright. So I just got an order from the provider that our patient, Frank Furter, in room 50, needs a dose of his insulin. He needs 16 units of NPH, and based on the sliding scale fee, he also needs 16 units of regular insulin because his blood sugar is at 208 right now. So I'm just going to go ahead and double check that on the MAR. Yep, I have the right dose, the right drug, and the right time. So I'm going to go into his room to also check the right patient, the right route. I see on the MAR that he had it at the right upper last time, so I'm going to do it at the right lower today. And afterwards I'll do the right documentation. Alright, so I have my MAR checked. I'm going to wash my hands before I start the procedure. And I'm just going to get my insulin ready first before I go into the patient room. I'm going to don my gloves, my clean gloves. Okay. And I'm going to take a prep pad and swab bottles of insulin. I'm going to check the expiration date. Okay. So both of the vials have been sterilized on top. Alright, and I'm reading that the expiration date, they both expire in July of this year. So we're good there, and they both have been opened for under 28 days. Alright, I'm just going to roll them up a little bit to make sure that they're not cold and they're not cloudy or anything like that. Make sure the medicine is all mixed up. Okay. Alright, I'm going to open my needle. Okay. Alright, and the order was for 32 total units, so I'm going to draw back 32 of air. Okay, uncap. And first, I'm going to inject 16 units of air into the NPH. Okay. And then 16 into the regular. Okay. And you always draw regular first, so now I'm going to draw my 16 of regular. Okay, and I'll have another nurse check. Okay, 16. Okay, perfect. Now I'll do my NPH. Okay, perfect. Alright, so I'm going to recap my needle using the one-handed technique so I don't poke myself. Okay. Alright. So now I have my syringe. I'm going to go ahead and I'm going to don new gloves and wash my hands before I enter the patient room. So I'll just verbalize that part. And then I'm going to enter the patient room. Knock, knock, knock. Hello, Mr. Furter. How are you doing?
Good. How are you?
Good, thank you. So I have new gloves on, clean gloves. So, Mr. Furter, I'm going to be giving you your insulin injection today. Is that all right with you?
Yes, thank you.
Okay. Alright, so this is just the alcohol swab. We're going to be giving it in the lower left quadrant today since it was in the upper left yesterday. This is cold. Alright, very good. I'm going to let that dry. Mr. Furter, can I verify your name and date of birth, please?
Frank F. Furter, 3/14/50.
Perfect. I'm going to go ahead and scan your wrist badge. Boop. Okay. Alrighty. Uncap the needle. Discard. Make sure the bevel is facing up. Mr. Furter is a hefty guy, so I'm going to insert it at a 90-degree angle, but if he were pretty skinny, I would do it at a 45 or 60. Okay, Mr. Furter, 1, 2, 3. And I'm not going to inject too fast so it doesn't burn as bad. Okay, release. Perfect. Alright, if there was any leakage or anything like that, I would dab it with a pad, but I would be careful not to massage it or rub it, but there's not, so I don't have to worry about that. Alright, Mr. Furter, here's your call light. Can I get you anything else while I'm here?
No, thank you.
Good, okay. Alright, and then I exit the room and I document what I did. 16 units of NPH and 16 units of regular into Mr. Furter's right lower quadrant. Whichever one I did, because I remember. And so that's good, and I document the time, the date, and signed by Sydney Stoltz, student nurse. And that's that.